Hello everyone, we are back. We're sorry for the technical difficulty due to which we had to earlier stop the live. So again, we're welcoming Dr. Rajvir Bhalwar sir with us, the Principal and Dean of Pravara Medical College. Sir has previously served as the Professor and Head of Community Medicine at Armed Forces Medical College AFMC, Pune. With a distinguished career spanning over 46 years as a medical teacher, academician, and health administrator, Dr. Bhalwar is also the author of Community Medicine Prep Manual for Undergraduates. This is the book. This book is now in its fourth edition and is published by Elsevier. So today we are discussing preventive social medicine, and that will include various public health issues, epidemiology, and preventive measures, keeping in mind the NEET PG exam. Thank you so much, sir, for joining us today. And if we can start the session by briefly talking about the crucial topics in preventive social medicine that students should prioritize for the NEET PG exam, and how should students approach studying this topic?
Okay. So thank you very much, Pooja. I must thank the organizers and the students who have joined us today. And I'm sure that NEET PG, which is going to take place in just another week or 10 days, is going to be a very high priority for you, and all of you must be preparing hard for that. Uh, to begin the issue, I'm sure you must be knowing this initial information that, as you know, the NEET PG has a total of 200 questions, and it is the time allocated is 210 minutes. But this time the change that has come up is that now it will divide it into 5 parts, and each part will have 40 questions, and you will get 42 minutes for that. And the moment the 42 minutes are over, you will pass on automatically to the next part. So also this brings to you the added importance of time management while you are answering, and time management also depends on how well you have practiced and prepared for the examination. So coming to community medicine, you can expect around 20 out of the 200 questions that are there. You can expect around 20 questions, or maybe up to 25, because if you include, there are certain questions which are from the integrated mode. For example, question may overlap between community medicine and general medicine, or with pediatrics or obs gynae. So that way you can expect another 4 or 5 questions. You can say whether they are preventive medicine or from any other specialty. But the fact remains that even if 20 questions are there out of 200, they are 10%, and it really makes a lot of difference, because as we all understand, the competition in NEET PG is very stiff competition, and even 1 mark would make a difference. So it's very important that we prepare well, and we prepare very specifically for the NEET PG examination. Now, theoretically speaking, I must at the start say that all the topics which are there in the curriculum, actually all are important, and we can't single out any one topic saying that this will not be asked, or this the priority can be very low for this particular topic, because what can happen is, even if you get one odd question from a topic which you have just not prepared, or two questions, and you don't get those answers, then you lose out 1 or 2 marks, and 1 or 2 marks even are going to make a difference. So the first thing is that you must study everything. It's not that you leave out anything. And also we must realize that as an undergraduate, you are looking at two things. First of all is your university examination, because you've got to pass your community medicine subject in the third professional part 1 examination. And then you are also looking at NEET PG. And as the things are, any time now, maybe next year or next to next year, the shift over from NEET PG may occur to the system of NEXT, that is a national exit test, which will be a little harder, because it will be now those type of questions and that pattern has still not been done till now. So there is a difference between the university examination and the NEET PG, which we are following at present, the pattern as well as the preparations. The only common aspect between the university examination, that is the third professional part 1, in community medicine. And the NEET PG is the common part is the section which you get on the MCQs, because NEET PG also you get MCQs. But also, the difference exists because most of the MCQs which are asked in the university exam, you will appreciate that even if you are getting in part A, the MCQs, about 20 MCQs, depending on the university, in each paper of community medicine, those MCQs which are asked in the university examination are generally of the recall based, what we call as a rote learning. So you give a sentence and you give four options which are facts. For example, the maternal mortality at present in India is, and you get four options. So you can't, there is no reason for that. It is there, so it is there. You have to know it. Whereas in the NEET, PG, what happens is, and particularly when the NEXT happens, a large number of questions will not be based on this recall or a rote learning or simple memory or cramming up, but many of them will be based on problem based or situation based exercises or on comprehension and analysis. So there will be a difference. Now for NEET PG, and as and when it is replaced by NEXT, you actually need to develop comprehensive understanding, especially of the core and conceptual subjects. Now, these core and conceptual subjects within the specialty of community medicine, I'll just describe later, because many of the MCQs will not be direct one-liners in the NEET PG as well as in the NEXT, definitely in the NEXT, but they will be based either on a problem or a situation will be painted and then the four choices will be given, or it will be based on a comprehension and recall, comprehension analysis rather, and again four choices will be given. For example, you may be shown the photograph of a particular instrument, or you may be shown the photograph or a sketch of a particular graph, and then you can be given four choices as to what it is or what it is used for. Now, most important, I would divide the topics in community medicine into four groups. The first one is the conceptual topics. Now, these are the most important because questions from these topics, they actually need understanding and not simply your cramming up or a rote learning. You can't simply remember them. For example, these conceptual topics, the most important of these conceptual topics, which are important for NEET PG and NEXT also, will be from epidemiology, which includes the various methods for screening for diseases, and they will from biostatistics. Now, these subjects need to be learned, and you should be understanding them well, the concepts involved, the reason why this happens, because by studying, you do it by, first of all, be attentive in your lectures, what your teachers are teaching, ask them questions, clarify the doubts, and also go through some good standard textbook which gives you the details, particularly in these two subjects. In biostatistics and epidemiology, it is more important to understand the concepts, why this is happening, and how to go about it. And for that, you need a good book for as a textbook also, and as far as your preparation for the examination is concerned. Now, also what will happen is you will find in these subjects, epidemiology including the screening, and also in biostatistics, you will find a number of questions will be based on problem based or situation based. For example, they may give you a situation that a study has been done in which the blood samples of the entire all the subjects have been taken for seeing the level of a particular biochemical marker, and as the as the follow period goes on, then all those who develop the cases, their samples are analyzed, and those who do not, a corresponding number of people who do not develop the disease of the same age, same sex, the samples are analyzed and the biochemical markers are compared. Now, this is a concept. They may ask you which measure can you calculate, whether you can calculate relative risk or odds ratio or incidence in the exposed group. Choices will be there. Now, this type of study, as you would know, many of you would have already prepared. It's a very special type of nested case control study in which it is actually a type of cohort, but it is also case control because you do not follow up the entire cohort, but you analyze the cases and the controls. So you calculate the odds ratio. Now, all these things you have to learn. because this question may be put in five different ways. Same is for statistics. Let's say you somebody asks you, there is a question in the NEET PG, that to see whether increase in salt intake is also associated with increase in the blood pressure, with the systolic blood pressure. We studied the subjects, middle-aged men and women, and we analyzed their salt intake, daily salt intake in grams per day, and their systolic blood pressure. What is the appropriate statistical test? Now, basically, you have to understand that what you are doing, you are trying to see a association. You are trying to see a association between two variables. One is salt intake and other one is blood pressure. Salt intake is a numerical variable. It is a continuous variable, because salt intake for persons could be 5 gram or 5.1 gram or 5.203 grams, whatever. So it's a continuously distributed variable. And the outcome variable is systolic blood pressure, which is again a continuous variable. Now the appropriate test for seeing the association becomes a Pearson's correlation coefficient. To analyze this, you must know. So therefore, what I want to emphasize upon you is that as far as epidemiology is concerned, biostatistics is concerned, and screening for diseases is concerned, these three have to be conceptually driven. You have to understand the logic behind. For example, they may ask you that which test will be better for having as a good screening test for HIV, and they may give you choices whether it's a high sensitivity, high PPV, high specificity, and so on. So you should therefore know what sensitivity means, what are the criteria in which sensitivity is assessed, why do you do screening, and given this, which particular situation will be best for which particular test or disease. So these are concepts. Therefore, I repeat that as far as for NEET preparation is concerned, and again I say that it is different from your university examination. Let's say, for example, in university examination also, you have the subject of epidemiology and statistics, which is given weightage. But in the university exam, you may get a question like define epidemiology, describe its uses, or discuss the steps in investigation and management of an epidemic. Now, that is a rote learning. You have to know the steps, you have to remember the steps, you have to write down the steps. But in the NEET PG, in a problem-based scenario, or even in a recall scenario, this type of question will not appear. It will like a situation painted, and therefore you must know the concepts. Now, next, after this, after having emphasized the importance of epidemiology, statistics, and screening for disease as conceptual subject, which you must know the concepts very well and understand. Ask your teachers. If you are attending some sort of coaching, you must ask your issues, things which you have not understood back from your tutors or from your teachers. The next one are the application-based questions. Now, application-based questions, for example, are application of what you learned. They also do not depend simply on your recall, but to some extent also on your recall. So let's say they may paint a situation that there is a female patient aged 25 years who is having dysuria, and a clinical picture is painted, and thereafter they give you four choices: which particular colored kit will you use on the basis of syndromic management of STIs? Or they may give a clinical picture of a newly diagnosed case of pulmonary tuberculosis in an adult male, and they may ask you which particular drug you will not use. So this needs two things. First of all, you must understand what are the various STIs, what are the various type of colored kits and the categories under the syndromic approach, and what this person is suffering from. Similarly, which type of tuberculosis this person is suffering from? Is it a new case or a relapse case or a drug resistant case? And under those circumstances, under the national program, which particular types of drugs are given and which is not given. So this is the second type, the conceptual, and most of these type of questions will come either from general medicine related to medicine, which are communicable diseases, infectious diseases, non-communicable diseases, pediatrics and obs-gynae, the maternal and child health, right? The third type of questions are basically the what again they come under the comprehension and analysis, but they are very specific. you may get one or two questions which are image based. Now these image based questions can be either they can give a image of an equipment, they can give a image of a Lowy bond comparator or a Horrocks apparatus, or they may give the image of a mosquito, particular mosquito, or the image of a Carter thermometer, and so on, or even the image of a epidemic curve. And then they may give you four choices. For example, in an epidemic curve, they may ask you this type of above epidemic has been caused because of food poisoning, gonorrhea, HIV, or IHD. So, given these choices, you have got to then analyze. So, this also needs a good amount of learning into the subject. Now, the last one are the simple one-liners, what you call as one-liners, and I prefer calling them as a recall-based question because you have to memorize them. You have to memorize the facts, and then you have to again think quickly and mark the correct answer. And there is no logic for that. Basically, there is no logic. It is there, so it is there. For example, they may ask you that one primary health center in a hill area covers how much population. They give you four choices, so you have to know that it is 20,000. So accordingly, the four type. But what happens is that the distribution of these, the problem based questions, you can put it as around, they will be around almost 40 to 50% of the community medicine. So out of the 20 questions which you expect approximately in community medicine, you can expect about 8 or 9 of the problem based, where you have to really tackle and you have to understand what the question, and then you have to back calculate. Another four, three or four questions of comprehension and analysis. What I gave you the example of STI and which colored kit to use. Another two or three questions which could be of the image based, maybe two or three, and the remaining three or four could be of one liners. Now, one liners is also not so easy because you have got to remember the facts hard. Now, for remembering facts, there are certain issues where the facts have to be remembered. For example, the level of chlorination, normal chlorination in the water supply is a fact to be remembered. The National Health Policy has laid down certain targets and outcomes. Those targets and outcomes have to be remembered. The healthcare of the community involves certain amount of PSCs, population and community health centers. They have to be remembered. For example, there is some remuneration which is paid to the ASHA and to the mother under in certain states under the JSY. So how much remuneration is paid, that has to be remembered. So you have to basically divide your entire preparation into these four groups. And after having grouped those questions which are of conceptual type, which involve your hardcore learning and understanding, you should read from standard textbooks, understand them, and if you are not understanding anything, do clarify with your teachers or with your tutors or with your coaching classes, wherever you are going. But do clarify them because as long as you don't understand them, you will not be able to solve them. The second thing is also try to understand the other two type, that is the conceptual base. But that conceptual base thing will be also, you'll have to remember the facts. So then most of them will be from the national health programs. For example, the drugs which are prescribed in the national health programs, the water supply sanitation. So those will be, and infectious and diseases and the non-communicable diseases. The third type will be image based. They are mostly either from environment and health, thermometers, uh, Horrocks apparatus, or some from nutrition. They may give you the image of particular millet and ask them what is this, or they may give you the image of a patient who is walking on two sticks and ask them which particular area is this disease more prevalent. So they are image based. The finally is that the facts. Now the facts are national health programs. There are some facts given in the national health policy. There are some targets given. There are some facts which cannot be changed, which you have got to learn. So that you have to keep a separate notebook and keep on noting those facts. So that while you are preparing, while you are revising, you can quickly go through those facts and remember those facts. So from my side, basically this is how I wanted to, sort of brief you on how to go about. But do remember one thing, that don't consider any subject as unimportant. Anything can be asked, and even one or two questions from a seemingly unimportant topic If they come, then they may actually lead to loss of marks of 1 or 2 marks. Losing 1 or 2 marks is also not a very good thing to have. So with that, now I'll wait. Any questions you have, you can post them to me or you can post them to Pooja. I'm ready to answer them. Thank you, Pooja.
Sir, one question is on national immunization program and how important it is from exam point of view.
See, the National Immunization Program, the few things you must understand. They they may paint you a picture. They will not probably directly ask you that DPT is given at what age because it's
Mhm.
too simple. But what they may do is they may ask you that a child who is aged 11 months has come to you and does not give a history of any vaccine being given, or a child is come at 3 years and he was given only BCG at birth. So you have got to understand those aspects, though they are very important. Secondly, is the cold chain and the vaccine return policy and the open vial policy. They may ask you that 4 vaccines were taken out for a vaccination session, after which all the used vaccines were brought back. Which of the vaccine cannot be put back in the refrigerator for subsequent use? So basically, you are looking at open vial policy. So
Right.
what you should do is be very sure that you know the system of cold chain, which vaccine is preserved where for how long, the open vial policy as to which vaccine can be reused, which cannot be reused, and thirdly, the vaccination or immunization in special situations. A child has not been vaccinated as a normal immunization schedule, so how do you deal with that problem? These three things are more important. Otherwise, national immunization schedule, to I presume all the each and every student would be knowing by heart, and I don't
Mhm.
think they'll ask such a direct question.
Okay.
Have I answered that?
Yes, sir. Yes, sir.
Okay.
Sir, another question was on the revised National Tuberculosis Control Program and its components.
Yeah. See, basically, that has been now changed to NTEP, National
Mhm.
Tuberculosis Elimination Program. Now, in that, you have to understand a few things. Number one is you have to be knowing very well as to what is the algorithm of diagnosing a case of pulmonary tuberculosis. Very important, and to a smaller extent of extrapulmonary tuberculosis. Number two is that what are the parameters of diagnosing drug resistance in the community tuberculosis program? Okay. The
Mhm.
third one is you must know, understand as to what are the various parameters. For example, when we say cured, when we say release from treatment, when we say relapse, okay. So all these mean what? Because that can be converted into MCQ, they will ask you. And number
Right.
four, the drug regimens you must understand and their side effects. The primary, the first line drugs, their dosages and their side effects, and also the second line, and maybe the drugs, to some extent the drugs for the for drug resistant tuberculosis and multiple drug resistant tuberculosis, because there could be one odd question out of this which could be answered by which there, see, there are certain questions which are used to discriminate between a student who is doing average and a student who is doing very well. So
Mhm.
these type of questions will be put, 1 or 2 questions you can expect of that level.
Right.
So if I repeat, one, you should know the algorithm of diagnosing tuberculosis. Second, you must know, preferably, also if possible, the algorithm of extrapulmonary tuberculosis. You must know the drugs, the primary line and the second line drugs, the drug resistance, the diagnostics where they are available. For example, a microscopy center is available where under the tuberculosis program. CBNet is available where? CBNet is used for what purpose? Who all should undergo CBNet? These are the things. So basically, focus on to the wherever the National Tuberculosis Elimination Program is given. You are find all these things, and then make notes on these important aspects.
Right. Right, sir. So that was all for the question. And lastly, sir, if we can, if you can briefly talk about the book, the community medicine book, the script manual for
Okay.
undergraduates,
Okay.
understand it's being
So,
prepared to mind the
thank you.
exams.
Thank you very much. And I'll quickly brief you because this book Actually, now it is in the fourth edition, and the fourth edition has been very recently introduced, released just a month back. So the special things about this book are that number one, it is specifically tailored for the university examination as well as the NEET PG and also the NEXT. How we have tailored it is that first of all we have there are a total of 21 chapters in this book only, and each chapter deals with a particular competency. For example, chapter 1 of this book deals with competency number 1, CM1, that is CM 1.1 till 1.10. Chapter 2 deals with the broad competency 2, that is 2.1 till 2.4, and so on till chapter 20, which deals with competency number 20. And we have chapter 21, which is preparations for practical. But those practical preparation will also help you a lot in the preparation for NEET PG, because there are a lot of epidemiological exercises, biostatistical exercises solved, there are spots which are images, and so on. The second aspect is that each chapter covers the entire CVME syllabus of that particular core competency and is divided into five parts. Now, part one is in long answer questions and short answer questions, duly solved and very crisp to the point, which improve your understanding and also writing of the level which is level one. That is must know. Then part two is long answer and short answer questions of level two. That is nice to know, and level 3 are those LAQs and SEQs which are may know, that is highest level. Then part 4 is problem based exercises, their correct answer and the reasons for that answer. And part 5 is MCQs, a large number of MCQs in the subject along with the answers. So each, like for epidemiology, there is a separate chapter. Statistics, there is a separate chapter, and every chapter will have these level one, level two, level three, long answer and short answer questions. And you have problem based exercises, and you have the MCQs along with the answers. And the questions and answers are written in a way that it improves the understanding. So when you talk of epidemiology, when you talk of a 2 by 2 table, when you talk of which type of biases are there, or in statistics, when you talk of basically whether which test to apply in this situation, what are the variables, what is exposure and outcome, everything is given there in a very conceptual manner and framed as a question and answer. So this book, and it's a very crisp book. It's in a small size book, and it's less than 700 pages. We have drafted and covered the entire topic, but specifically it is for preparing for your university examination as well as for the NEET and NEXT. It has been tailored like that, and I'm sure it will help you a lot in preparation for your NEET as well as the university examination. So that's in a very brief description about this book.